What we're doing today is a lumbar medial branch block. This patient has a lot of low back pain. She has a lot of arthritis on her MRI. So what we're doing is we're testing to see if her lower back pain is indeed coming from the arthritis in the joints of the back.
So when you're seeing someone in the office, what's a good way to know that their pain is coming from the arthritis? You know, herniated disc or a pinched nerve or something like that. Like how can a patient know?
Good question. Well, first off, the patient tells us, what their symptoms are. So if a patient has pain that is in the back, but then it radiates down her lower back, then I'm thinking that she might actually have a pinched nerve. This patient in particular only has lower back pain. It's a combination of the pain that she's feeling plus the symptoms that she has. So she has lower back pain. The pain is only localized to the lower back. It's worse when she's standing or when she's extending her back, because when you extend your back, you put pressure on the joints. So she had symptoms of lower back pain, in addition to pain with prolonged sitting or standing, pain when she's extending her back. And then to confirm it, we did an MRI, and the MRI showed that she had facet arthrosis, which is just a fancy word for arthritis in the joints of the back.
And now you said that this was a way to diagnose it as the cause of the pain.
Exactly.
So how long can someone expect to get relief after something like this?
This is just a short-term diagnostic block, right? So all I'm injecting is essentially bupivacaine, which is a little bit longer lasting version of lidocaine. If she feels relief, even if it's for a few hours or a day or so, that's a successful block. Her pain should probably end up coming back anyway. Sometimes patients feel pain relief for a little bit longer, but that's because we're breaking the pain cycle. They're able to kind of finally feel some relief. And some people even feel a little bit of an increase in their pain once the lidocaine wears off, because they finally feel relief in their lower back.
So if someone does have some pain relief, but it's only temporary, what would you do after this?
So this is medial branch block number 1, aka diagnostic block number 1.
Okay.
So if she feels relief, for 2 reasons: 1, for insurance purposes, and 2, to actually convince ourselves that this is indeed what's causing her pain.
Does anything change on the second block? Like are the needles still in the same spot? Are the medications all the same?
Good question. The second block is pretty much exactly identical with the exception of the anesthetic.
Okay.
So we use a different numbing medicine when we do the second block.
Okay. So basically proving that the first time wasn't a fluke.
Exactly.
And then let's say the person's happy after both blocks. What's next? A third block?
Now that we confirm twice that this is what's indeed causing this patient pain, what we do is we proceed to the ablation, which is a radiofrequency ablation.
Okay, what does that mean?
And that pretty much essentially means that we're gonna burn the nerves in that same location that we blocked it twice. And by burning, I mean we use that machine over there.
I'm familiar.
Oh, okay.
Well, I have another question about your radiofrequency ablation. So then you say you go to the radiofrequency ablation, Dr. Al. How long does that last for?
That's another great question. So most studies show that patients find benefit for roughly, on average, 6 months or so. The insurances allow us to do it every 6 months, as long as a patient endorses roughly 80% or more relief with block 1, block 2, and the ablation for roughly 6 months or so. Insurances allow us to do it again.
And when you say again, do you have to do those blocks again, or can you go straight to the ablation?
Well, the good news is if the patient already finds relief once with the ablation, we don't have to do the first 2 steps. We can go straight to the block.
You got to jump through the hoops at the beginning, and then you're all set.
Make sure you sanitize the hand. No, you're good. ¿Está bien? How do I see you forgive me?
¿Me perdones?
¿Me perdones? ¿Sí?
¿Por qué?
For what? For the Lord.
No está bien, no está bien.
Okay, gracias. Con Ashley.
Ok, vamos a sentarnos, ¿ok? ¿Por qué estás aquí?
Yo estoy aquí por ese dolor que me tiene sin vida. No tengo vida con ese dolor. Es un dolor permanente que no me deja hacer nada. Tengo que acostarme obligado me tengo que acostar. Porque estoy cocinando, tengo que apagar la estufa y acostarme de ese dolor tan grande que tengo.
Really bad pain, difficulty with just living, difficulty especially while cooking, but yeah, the pain is what brought her in today. ¿Esto era la primera vez que estuviste aquí?
No, yo he venido como 4 veces aquí o 5 más.
4 or 5 times. ¿Esto era el primer procedimiento que hemos hecho?
Sí, este es el primero.
Yes, first one. ¿Cómo nos encontraste? ¿Cómo sabes de nosotros?
Bueno, mi médico primario me dio un referido para que viniera aquí.
her primary center over to us. ¿Tenías miedo sobre el procedimiento?
Sí, yo tenía miedo, pero pues yo dije, bueno, yo con ese dolor, yo voy ahí porque los médicos saben lo que hacen. Además, aquí me dijeron que yo le dije que si era peligroso, algo, bien que no, que eso no me iba a hacer nada, que yo podía caminar, que yo podía todo.
¿Y no estaba tan mal? ¿Cómo se siente después del procedimiento?
Ahora, no, todavía no me ha hecho mucho.
¿Y cómo está el doctor? ¿Te gusta el doctor?
Sí, está bien, él es bien.
Yes, he's nice. Eso es todo. Muchísimas gracias.
Thank you.